Sydney Baumgartner, a student in Indiana State University's Doctorate in Athletic Training program, and today I'm going to talk about injury prevention and disablement model. I'm going to cover multiple different topics and then tie them together at the end of the presentation. So the background, when I talk about the case example, I'm talking about chronic ankle instability in the collegiate women's volleyball athletes, and the screening tool that was used in this example was a STAR excursion balance test. First, we're going to talk about the disablement model. The disablement model is an organized way for healthcare professionals to track information related to a case to ensure that the whole person is considered in treatment. There are multiple levels. The first level is the health condition. The health condition is the pathology that the patient in the case is dealing with. In our case example, that is chronic ankle instability. The body function and structure is the next level. This is the psychological and physiological factors of the body. In the example, this would be the anatomy of the ankle, psychological readiness to return to volleyball, and could be physiological readiness to return to volleyball, and the psychological need for ankle braces or tape. The next level is activity. Activities are basic activities affected by the pathology. These can also be activities of daily living. Case examples are walking, running, going up and down stairs, balance. The affected ankle can feel weaker than the other side. Participation. Participation are events that are affected by the pathology. So in the case example, these are any of the events as listed below, and could be more, that are affected by the pathology that could decrease the patient's ability to play volleyball. Environmental factors. Environmental factors can be societal-based or based on the area that the patient participates in. Societal-based case examples are coaches, teammates, friends, parents, and scholarship. Environmental-based case examples are the conditions of the court and anything around the court that may cause the patient to have to dodge or cut in a unexpected way that could cause damage to their ankle. Personal factors are the history of the patient or any personal information that can pertain to the current case. In our case example, the patients are college-age volleyball players, females, and if they have ever had an acute ankle sprain before, because this can contribute to chronic ankle instability. Next, I'm going to talk about risk factors. Risk factors, the two that I'm going to touch on are modifiable and non-modifiable. Modifiable risk factors are elements that can be changed. These are things like that can be changed within a day or short amount of time by the patient. So things like the shoes worn, the condition of the court, their muscular strength, their skill level, and the other things listed there as well. Non-modifiable are elements that cannot be changed. So these are things like age, sex, height, the individual's anatomy, and events that happen during practice or during competition. Yes, some of these things can be fixed surgically, but we're talking about basic fixes. Injury prevention. Prevention is stopping a specific event from happening. There are 3 levels of prevention: primary, secondary, and tertiary. Primary is taking away the chance for a specific pathology to occur. So in our case example, that would be removing the patient from the sport of volleyball entirely, because then they cannot develop chronic ankle instability from volleyball. Secondary was when the patient already has some signs and symptoms of the specified pathology, so the clinician is working to make sure that they do not get worse and develop into the full pathology. Our case example would be the patient has these signs and symptoms, and the clinician is working to develop a rehabilitation program in order for the patient to decrease these signs and symptoms. Tertiary is when the patient has already gotten into the full stages of the signs and symptoms associated with the pathology, is diagnosed with the pathology, and the clinician is trying to decrease the effects of the pathology on their long-term health. So this would be the volleyball players already diagnosed with chronic ankle instability, so the clinician is developing a rehabilitation plan to strengthen the affected ankle and develop a stronger proprioception. Chronic ankle instability prevention in general includes ankle strengthening program using the steps listed. They can have a proprioception program, which mainly focuses on balancing, as well as changing the environment, making it flat and not have any holes to protect the ankle. General prevention for chronic ankle instability in the case example would be all the things listed above, as well as cutting and jumping drills and making sure the environment is safe and the volleyball court is safe for the patient. Health-related quality of life is how an individual's health affects the emotional, physical, and social aspects of their daily activities. In the case example, health-related quality of life is anything that may be have pain that the patient carries out in their daily life activities. Altogether, the disablement model allows the clinician to see all aspects of the patient's life that are affected by the injury. This allows factors to decrease the patient's health-related quality of life to be identified. When this is known, the clinician is able to understand the pathology better in order to identify the risk factors and prevention techniques that can be manipulated in order to ward off completely rid of the condition. So in the case example, we would want to identify what the chronic ankle instability is causing the patient to have pain by doing. Then this can be a psychological and physiological pain. The patient then will undergo rehabilitation in order to take care of those issues, and then the patient's health-related quality of life should increase. The disablement model can also help provide us information on where those issues are taking place. Thank you.